Hi, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks, with a video preview of the April issue of H&HN. Let's start with the story that Hayden Bush wrote about CEO burnout. Hayden talked to a number of consultants and CEOs about the pressure that CEOs are feeling given all the change that's going on in healthcare. Some CEOs are ready to bow out, while others are energized by the dramatic transformation healthcare is undergoing.
So this month's cover story explores the issue of CEO burnout. One of the things we've been hearing from the field lately is that a lot of hospital CEOs are getting stressed out by a lot of the challenges that are popping up right now. There's value-based purchasing, there's pay-per-performance, there's ACOs, there's this whole kind of shift to a new delivery system. And for folks who've been in the profession for 25, 30 years, it can be pretty challenging. So some consultants have told us that they've heard anecdotally of folks who have either been forced out or have decided that they're just not up to taking on the next 5 to 10 years of change. But then at the same time, we're hearing from the field that a lot of hospital CEOs are really embracing these challenges. And I talked to a few of them, and they really seem like they're energized for the challenges that are coming up in the next few years. And they're also looking for help from their teams in ways that they haven't looked for before. So some of them might be looking for their CFOs to step up and be a little more strategic than before. They might be looking for a little more clinical help from the rest of their C-suite team. But overall, they're really, really energized about taking on the challenges that face them and really confronting how to make their hospitals provide better care.
And next we'll go to Bill Santamore, Managing Editor for H&HN. Bill's going to talk about the next in our series of clinical management stories. This article looks at robotic surgery and whether or not it makes sense for hospitals to go ahead and buy Da Vinci robots or not.
One of the features we have in this month's issue is about robotic surgery, and specifically the Da Vinci robot, since it's the only game in town at the moment. And the fact that 1,200 hospitals around the country have so far invested up to $2 million in buying a Da Vinci robot, and it costs $150,000 a year in maintenance. So is it worth it, is the question we ask, and the answers are varied. Critics say that there's not been enough comparative research done on it to determine whether it's better than regular laparoscopic surgery. And they say that the reason that it's so popular is because of clever marketing. However, a lot of physicians are demanding that their hospital get it, or they're moving to hospitals that have a Da Vinci, because they say it's more instinctive, it's more intuitive, it allows them greater flexibility, and it is able to really get to the point where they can see even the smallest blood vessels and the smallest nerves. But for hospitals, maybe the most important factor in whether or not to buy one is public demand. Patients are coming into hospitals. We talked to several hospitals, and they're demanding that they get their surgery through robotics or they'll go someplace else. And we talked to one hospital specifically that said that they have managed to increase the number of surgeries they do enough that they paid off the cost of the robot over 2 years. And they've increased their market share. They have expanded their service line. We have a sidebar that goes with the story called The War of the Robots. So eventually, Da Vinci won't be the only one on the market. There are partnerships out there that are developing other surgical robots.
And finally, I had the opportunity to sit down with Teri Fontenot, CEO and President of Women's Hospital in Baton Rouge, and the new chair of the AHA Board of Trustees. Teri and I talked a lot about the challenges that hospitals are facing in 2012 and what her goals will be as chairperson. So that's a preview of the April issue of H&HN. It'll be hitting the newsstands pretty soon. I'm Matthew Weinstock. Thanks for tuning in.